Hey, what's going on, everybody? Good to see you again. Welcome once again to the DA Perspective. We got a lot going on this week, so we're just going to try to jump right into it. First thing I want to do again, I want to send a special shout out to all the frontline responders at the moment. I mean, we're talking about the nurses, police officers, firefighters, anyone who's basically part of taking care of this whole, taking care of the healthcare element of helping people that are afflicted by this. And again, I also want to show some love to people who aren't on the front lines. I want to show love to the people at home taking care of their kids now in ways that they haven't had to for a while. I mean, they don't have school. So you're at home, and a lot of these people are working and taking care of their kids, or they're not working and they're at home with their kids all day and they're trying to figure out, what do I do? So, yeah, I commend all of you for doing your best during this tumultuous time. And as I've alluded to before, it's really shitty that our leadership doesn't really give us any guidance on what it is that we're supposed to be doing or how best to kind of work with the situation. So, I wish you all the best, and you're definitely on my mind. And I know that, in the future that things are going to get better for everyone involved, and we're going to, come back a little bit stronger than this, ideally. Like I say right here, we survive together. So at the end, I want to give a little bit of instruction on how we can better communicate with each other and make sure that we kind of don't lose our way, where we came from, what we're doing. So yeah. All right, let's jump right into it. I want to give immediate updates on coronavirus. Shocker. So yeah, let's pull up the New York City clip. Let's do that. For the most up-to-date instructions that, were being given from our leadership. So yeah, you ready to cue that up? We got good. We got audio coming in from that as well.
Harder to capture, but here's a fact that graphically spells out the ruthless speed of this pandemic and its devastating impact. More people have died in New York in the last day than in nearly the whole of March. The state's death toll doubling since Tuesday to more than 3,000. And tonight, new hotspots erupting across the country with still no national strategy or unified defense plan. But here in the epicenter, the plea for help is piercing in its urgency. And with our team in place, New York is where we start tonight with Gabe Gutierrez.
This is the emergency room inside Maimonides Medical Center in Brooklyn. Doctors now call it a battle zone.
Everyone that's in here today is here due to breathing problems, almost uniformly all from COVID.
Tonight, growing anger from the nation's coronavirus epicenter.
We are afraid for our patients. We are afraid for our families. We are afraid for our lives.
At another hospital, these nurses are calling it a daily suicide mission with a lack of PPE, personal protective equipment.
This is life or death. Every hospital in the state of New York and across the United States should have the supplies they need.
Governor Andrew Cuomo has now signed an executive order allowing the state and the National Guard to take ventilators and PPE from hospitals that have too much and redistribute them to those who need it most.
Am I willing to deploy the National Guard and inconvenience people for several hundred lives? You're damn right I am.
The mayor is urging New Yorkers to cover their faces when going outside to keep them from spreading the virus to others. Now, an urgent
So I want to talk about two things real quick about that clip. So the first thing that I want to talk about is the PPE for the nurses, right? So here's the problem that we're having. There's not enough to go around, right? There's not enough of this equipment to get people what they need. That is a problem. That shouldn't be happening. We're literally we parade around the world and we tell everyone that we're better than them and that we can do anything. We have the most shit hot military in the world and we fucking kick ass. But we can't fight this virus. We don't have the equipment we need for this. Again, when we talk about nationalized healthcare, this is exactly why we need that. Right now, our healthcare system, because it's so fragmented, there's no single point of planning, right? There's no single point of, okay, we start from the top and we disseminate down in an orderly fashion. No, it's a free-for-all right now. There is a stock supply that the government has of certain equipment. And then there's stockpiles and reserves of what each state has, right? So I don't have that clip, but there's a clip of Jared Kushner literally yesterday or the day before yesterday talking to a reporter about supply, right? And he said that the supply that the feds have is for them. It's not for the states. Literally in the operating instructions for I think it's called like a national stockpile or something like that. It's this it has equipment and stuff in it. Literally, and they're operating. It's on their website. I found it. I should have pulled it up. Anyways, it says the reason why this exists is to supplement the states when they need it. And this guy literally is out there telling, "Whoa, we have our own. It's not for the states." What does that even mean? What does that even mean? You only exist to assist the country with what we're going through. The only reason our government should exist is to serve the people. So if you're not serving the people, then who are you serving? And we'll actually get into who they're serving in a little bit. But so yeah, the reason why we don't have enough equipment, one of the reasons why we don't have enough equipment for these healthcare professionals is because of our fragmented healthcare system and the lack of a nationalized system that puts the American people and their lives in the front of every decision-making process. Because right now, everything that they're fighting about is money. Money. Who's paying for it? Who's paying for it? Who's paying for these supplies? Who's paying for these gloves? We should have already had that. We as taxpayers have already paid for all of these things. You just decided to go spend our money on other shit.